Hey folks, this is part two of my Worker Power Hour two-part series on UPS Teamsters and the COVID-19 pandemic. My name is Dave Schneider. I'm out of Jacksonville, Florida. I'm a UPS Teamster, package driver, and union steward. In part one of this video, we talked a little bit about the sick leave program that UPS management and the IBT, the International Brotherhood of Teamsters, agreed to about 2 weeks ago. We talked a little bit about how you can use that, what makes you eligible. We talked about what workers might be more at risk and should take some extra precautions right now by consulting a physician. And, we also talked about some of the symptoms, how to recognize, if you really need to go see a doctor, and just to take this very seriously. In this part of the video, we're going to be shifting gears a little bit. We're going to talk instead about some of the hazards that we're just going to face as UPS workers. We're going to talk about the measures that the company is taking or not taking in many cases to protect our safety, our family's safety, and our lives from this COVID-19 pandemic. And we're going to talk about some of the demands that are being raised by Teamsters around the country. These are not demands I'm just giving you off the dome. This is from talking to people, package drivers, part-timers every single day who bring these things up. And you look on some of these Facebook groups that UPS Teamsters are a part of, and there's some things in particular that I think are common experiences, not just in Jacksonville. I think they're everywhere. And we need to talk about them, and our union leadership needs to take them very seriously and explore their options in pressuring UPS to meet some of these demands. So we'll talk about all of that here. I guess first, just to start, reason I'm doing this whole video series is as of tonight, which is March 31st, we are now in the United States at 187,000 cases, confirmed cases of COVID-19. Now, the actual case count is probably way more than that. These are just cases that have been tested and confirmed, by a lab or by, a hospital. And we have had 3,800 deaths in the United States. Also, the death count's probably higher. These are deaths that, the person who died, confirmed case of COVID-19. And one of those deaths that happened tragically about 2 days ago was, to my knowledge, the first UPS Teamster to die from COVID-19. William Young of Teamsters Local 710 out of Chicago. He was a 15-year feeder driver out of the cash facility up there, succeeded by his wife, Rita, and his family. And, I just once again wish them my condolences from the bottom of my heart. I know that William's death really shook me up. Judging from the reaction online, I think it shook a lot of people up, and kind of was a bit of a wake-up call that, hey, look, we need to take this thing very seriously. A lot of this stuff y'all are probably pretty familiar with, but UPS has been classified by the federal government as essential critical infrastructure. Basically means we're core to the economy, and practically what it means is that even if there's a quarantine or a curfew or whatever, UPS is probably still going to be running, and we're probably still going to be at work. It makes some sense given the deliveries we make, delivering to hospitals. I know, like medical supply companies. We deliver a lot of stuff to people's houses, insulin, medication, cleaning supplies, that sort of thing. It's like UPS is kind of a big deal. It's like we have, any given day, I think 4% of the United States gross domestic product that we're handling at UPS. So, that part of it makes sense. But what that means practically is that, we're going to be continuing to work, and we're going to continue to face a daily risk of exposure to COVID-19. And this isn't just some laughing matter. One of our brothers just passed away up in Chicago from this. So it really behooves us to kind of look at the hazards of the job and, make sure we take precautions. But ultimately, this company needs to be taking precautions and needs to be taking our safety out there in the field or inside the warehouse very, very seriously. They put their profits first above our lives, even though our labor is what actually builds those profits. It's what makes it possible. We generate the value that UPS has across the country. We're the reason anything gets from point A to point B. And yet, I think it's a common experience for everybody. I know in Jacksonville, the preparations UPS did for the COVID-19 pandemic were awful. They were pitiful, and frankly, an insult to all of us. Which brings me, I guess, to say a press conference that happened 2 days ago, March 29th. I was in Washington. The Trump administration held it, and speaking there was UPS public affairs official Laura Lane. Laura got on TV and said, we're going to need great logistics to beat this pandemic, and UPS is ready to provide that. We have an army, a brown army of 400,000 workers or whatever. And what she said on there was kind of, it was news to me, and it was news to a lot of people, saying UPS is taking this very seriously, and they've implemented all these measures. The one she decided to specify is that UPS is disinfecting all of its facilities and vehicles daily. That it's providing sanitary supplies to all drivers, meaning like gloves, hand sanitizer, disinfectant, that sort of things. And that they're telling sick employees to go home if they're, showing symptoms or feeling ill or what have you. Well, here's what's really going on. What's really going on is I had to file a grievance about a month ago. I filed under Article 18. It was after a day of delivering a business route where I had a fair amount of hospitals and other medical facilities who were taking COVID-19 incredibly seriously. They had signs on the door. Some of them wouldn't even let me come inside to make the delivery. And, I realized, look, they're right to do that. But it's like, what kind of preparations do we have? And, outside of a couple of tips, like wash your hands a little bit more, we've been given absolutely nothing. I filed a grievance under Article 18, which is the safety article, and then I also under these OSHA guidelines that came out at the start of March called Preparing Your Workplace for COVID-19. And, in the grievance, basically, I demanded that we ought to have gloves, sanitary, disposable, vinyl gloves, for drivers who are delivering to hospitals or other places that are high risk. Just to say, I filed this grievance after talking to a couple of supervisors and managers who really wouldn't commit to anything like that. And by the time I got back that night, there were a couple of boxes laid out, I think 3 of them, for drivers. It's like, all right, that's a start. But here's the reality. Right now, if you're a package driver, you know what I'm talking about. At least in Jacksonville, we have about, 2-3 boxes of gloves that are laid out in the room where you go grab your dyads. And I guess you're just supposed to grab a few for the road or, split them with these other drivers. And it just doesn't work that way. It almost defeats the purpose of gloves. First of all, you cannot wear the same pair of gloves all day. One, they would rip because of our job and, at least down here, the Florida heat and everything. That wouldn't even work. But above and beyond that, it kind of defeats the purpose of having, sterilized disposable gloves. If you only have a couple of pairs, you're pretty much having to parse those out over the course of the day. Reality is, every driver needs to go out with a box of gloves, and then workers who work inside the hub who are working in, particularly risky areas. I'm thinking particularly like next day air recovery. You got a lot of international packages, some even coming from Italy, I hear. It's kind of ground zero right now for the pandemic. It's like those people should have gloves. Absolutely. They should change them a couple of times over the course of the shift. So that was one of the things. The other one, we have no hand sanitizer that's provided to drivers, let alone any random employee. And it's like, they don't have hand sanitizer stands or dispensers throughout the facility either. They haven't installed anything like that of any kind. It's like, if you're at work in the hub, you can go to the bathroom or there's a couple of sinks where you can wash your hands with soap. But it's like, for people who are a ways away from the bathroom, or for drivers who are out on the road and we're touching all sorts of stuff. And it's like, you don't have a bathroom in the back of your truck. Why can't we have hand sanitizer dispensers installed in these trucks? It's like practically overnight, UPS installed these GPS cradles, for us to put our dyads in and be able to get directions to, where our next stop is. Practically overnight they did that. It's like hand sanitizer dispensers. This stuff's going to be life or death, for a number of drivers. And yet we still do not have that. I've never been given a bottle of hand sanitizer, in the morning or seen a bin where I could just grab one out, which probably wouldn't be a very good idea anyway. Regardless, that old thing that Laura Lane, public affairs official, said at that press conference, that's bunk, okay? And the measures they have taken, woefully insufficient. Beyond that, Do they sanitize these trucks every night? I've seen that, yeah. I mean, they started that about a week and a half ago. It should have been started a long time before, but I'm glad to see it. The biggest problem I see here is that the folks who are now in charge of sanitizing our package cars every night that we come back, they are the car washers. And, I've never seen car washers yet in Jacksonville outfitted with protective personal equipment, gloves, masks, that sort of thing. I see them come in with disinfectant. These guys, they do a great job. I feel a lot safer going out the next day, especially because I'll get moved into a bunch of different trucks over the course of the week. But I worry about those car washers because they don't have the equipment, just like we don't have the equipment when we're out there. Totally insufficient. It's a total willful disregard of people's safety. And then I'll say this, and I think a lot of people feel this too. There has been practically no disclosure of possible exposure to COVID-19 of other employees who might have tested positive. It could be that there really haven't been any UPS workers in Jacksonville who have tested positive. I seriously doubt that, given that we have a facility of 2,500 to 3,000 workers. It's one of the biggest employers in the city. I mean, statistically, those are pretty rough odds. That could be the case. I really, really doubt it. And more importantly than that, Amazon just came under fire because they had knowingly not been quarantining employees in work areas with people who had gotten sick. You work with a guy or girl who's, tested positive for COVID-19. Theoretically, you're supposed to be quarantined too for 2 weeks. Go out on sick leave or something like that. Amazon was suppressing that, and it just came out in the news a couple of days ago. I'm half wondering if, I don't have evidence of this yet, but I'm half wondering if something similar is going on. Maybe they're citing patient privacy concerns or something along those lines to avoid notifying employees. Why would they do that? I think this gets into, sort of the bigger question here. Why would they do that? Why would they, not quarantine employees who might have been exposed to COVID-19? Well, there's a very particular reason why. Is that while UPS is classified as by the federal government as critical, essential infrastructure, it needs to be open in case of emergencies. UPS is not a public utility. It's not out there, existing just to get packages from point A to point B. Yes, that's the industry they work in. But UPS's sole legal obligation is to its shareholders. It is to deliver a profit, or the highest value it can, to its shareholders. That is legally what UPS is. It's a corporation, okay? And so the reality is, and I think everybody knows this, labor, us, the UPS Teamsters, the hundreds of thousands of us across the country, we are the reason that this company is profitable. If we don't drive, if we don't show up to load, profit doesn't get made. The packages don't get anywhere. Managers, investors, these people in Wall Street, the investors, they have nothing to do with it at all. It's us. It's our labor that builds the value of these companies. So here's the thing. The reality is, especially in a really big workplace like UPS, one where we're interacting with countless coworkers, packages coming from literally all over the world, and then for drivers who are out on the road interacting with, God knows how many customers on a day-to-day basis, it's like, we're going to be exposed to this thing, and if we all get sick or have to go out on quarantine, well, suddenly the operation starts to kind of, level off a little bit. And, UPS, in wanting to deliver profit for its shareholders, they want us to continue working, whether we get sick, whether we're exposed to risk or not. Yes, we have sick leave. Yes, if you go and try to use it, you're going to be able to. But, they're not going to be doing us any favors. That's why I said in my last video, we have got to be looking out for each other. If you see somebody who's, confused or whatever, point them to some of the materials on the Teamster website. TeamstersUnited.org has some materials about how to use sick leave. You can point them to this video. They need to go see a physician, especially if they're having symptoms or something like that. But, UPS, the point is, they want you to keep working because ultimately they care about those shareholders. It's not like a question of taking care of us and taking care of the public or whatever. It's about money. It's about the bottom line. That's what I'm saying. Do not expect this company to give a rat's ass about you. at the end of the day. They want you for your labor. And, if they can replace you, and we'll talk about that in a second, they absolutely will. Let's talk about some of the risks and some of the legal backing that workers have working in essential critical infrastructure like UPS. So OSHA's guidelines that they released, these are non-binding, they're not legally binding, at least right now. I think in some states they probably are. But what they do is they break the workforce into 4 levels of risk. First is, very high risk. And those are medical professionals or people working in mortuaries who are basically directly working with people who definitely have COVID-19, like deceased patients or, people working in those hospitals. Your high risk, which is the second tier, those are your workers who have a pretty high chance of being exposed to it. So basically, almost anybody who works in a hospital falls into that category. My reading is that if you are a package driver and you are delivering to a hospital, you probably fall into that category too. I don't see why you wouldn't. You on a day-to-day basis are going to be exposed to people or facilities or surfaces, that have a pretty high probability of having COVID-19. So I think we would probably fall into that camp. Medium risk, the third one, is basically anybody who works in a more or less social workplace where you're interacting either with a lot of customers or a lot of other coworkers. So, if you're an inside employee, you're not interacting with customers, but you're definitely interacting with a lot of coworkers. Maybe there's some jobs that are more isolated than others, but I think that most of us probably fall into that medium risk category. And then, your low risk are your people who, work from home or, work remotely or what have you. But, it basically breaks it down into those 4 levels. Like I said, we probably fall into medium to high in that range, which means that we need to take a lot of precautions. And what the OSHA guidelines recommend is that we be furnished with appropriate protective personal equipment. Gloves, disposable vinyl gloves, sufficient to be able to get through, any period of time or during the shift we have any kind of risk. Masks. We don't need respirators. We don't need N95 respirators right now. Those probably should be held because there is a shortage right now, for medical professionals and staff who are just, grossly ill-equipped. And that's its whole own other subject matter. But, some kind of masks. And here's the thing, a lot of misconceptions about how these masks work. There's some evidence that suggests wearing masks reduces the risk of you catching the virus. But the more important thing with masks is that since, if some studies are to be believed, as many as 50% or more of people who get COVID-19 will be asymptomatic, meaning they don't show any symptoms at all. The masks prevent you from passing the virus to somebody else. They're not, your normal surgical masks are not going to, filter out the virus the way that a respirator would. But, if you have it, you're just not showing symptoms, you plus another person wearing a mask, if a fair amount of people do it, it does cut down the risk. Hand sanitizer, that's another piece of protective personal equipment that is mentioned in the OSHA report and frankly matters to us a lot. And, access to soap and water is ideal. Hand sanitizer is kind of like the backup, in my mind, there needs to be hand sanitizer dispensers installed in basically, every couple of yards in a UPS facility so that, workers in a work area can access that regularly and make sure they're staying clean. And I think there needs to be dispensers in every truck too. Workplaces need quarantine areas where if a worker is suddenly showing symptoms, they can go, while they either wait for the ride or, get checked out by a physician or what have you, but making sure that they don't spread it to somebody else, needs to be sterilized, that sort of thing. And then finally, this last one, OSHA's so, kind of gung-ho on this, and unfortunately, I think it's the one UPS has failed the most at, is they have to develop a plan of action, but then communicate it to the employees. Now, I don't know about y'all, but the communication on an overall plan of action has been incredibly poor. It wasn't until 2 weeks ago that we had sick leave announced and guaranteed. And I know I was getting questions as a union steward constantly about what people were going to do if they got sick or if a loved one at home got sick. I'm glad we got the sick leave issue at least partially resolved for now. But the reality is that there's a lot of, what ifs and uncertainty about the future that has not been, clarified or communicated or discussed. I'm hearing that a tremendous amount of part-time employees just in the Jacksonville hub alone have never been talked to by their supervisors about the sick leave program or about possible COVID-19 risks. That disturbs me greatly, because what that means is that some of the employees that probably are, in some ways the most vulnerable, you have two guys unloading a trailer, or, people working on a sort aisle or what have you, interacting with each other. One of them has COVID-19. The other one very well then might catch it if precautions are not taken. And if people don't know to look out for, this, that, or the third symptom, they don't know what programs are available, you're going to have people who think, I can't afford to miss a paycheck, I'm going to come into work. The communication's been awful. And, frankly, I feel like UPS has communicated more to the public, to restore investor confidence and customer confidence than they've communicated to their own employees. It's been a little different with package drivers, I'll admit. They've talked about it at a couple of different, PCMs, but it's kind of a slightly different thing. I mean, it almost always is with this company. It's like the part-timers have one issue, and then, the full-timers have another, but fundamentally it's part of the exact same thing, which is that UPS is just kind of willfully negligent about our safety in the face of this pandemic. So let's talk about a little bit about why UPS has been so negligent. Like I said, the company is probably, and they already kind of have to some extent, telling us, oh, we're so important, thanks for doing such a great job. I've gotten more pats on the back from everybody, all the way up to President Trump in the White House about how important we are, Thanks for coming in. We really need you to make these critical deliveries. I want you all to hear this, okay? Because yes, we are, and basically any worker that's continuing to work right now, not least of which are healthcare employees, be they doctors, nurses, the janitors, the people who, clean up and sterilize hospitals, the food service workers there. Workers in our society right now, I think one thing this pandemic's really proven is that nothing happens in America, nothing happens in any economy without the working class. And so, in that sense, yes, we absolutely are heroes. And, yeah, you can tell me great job. I know, we're putting ourselves on the line. But I don't want people to internalize that too much, because there's a reality. I need you all to hear me on this. This company can and will show you out the door and to the unemployment line the minute that labor costs get too high and volume drops off and they need to do layoffs. They'll go in seniority order, of course, but the reality is you, me, any of us, if we ever get in the way of profits, they will not hesitate to cut us on behalf of Wall Street, on behalf of their shareholders. They don't care. And so all this talk about how great UPS workers are, how important what we do is, it is important. I'm not saying it's not. But just remember, UPS is not out there providing a public utility. They're out there to make money for the shareholders, even if it means at the expense of you, your family, your health. And that's why we have to look out for each other here. Here's the reality too. My package drivers know this a lot, but I think, everybody handles, these packages in one way or another. I really think it just does violence to the idea of essential critical infrastructure when you look at some of the stuff that we're delivering. I'm talking about the cases of wine, the Sephora makeup boxes, the Amazon headphones, the designer swimwear, the jewelry, whatever. Critical, essential infrastructure for you. And this is what I really want to hammer home. We're still working long hours, and I know some people really want them. Some people are like, I'm really glad I'm working this job or whatever. You got to realize the longer you are at work, the longer you're out delivering to people, or the more stops you have or what have you, you're just opening yourself up to more risk. And that's fine. We're going to continue working, but the truth is there needs to be some kind of triage on this stuff. If UPS cared more about our safety, it would be like, all right, look, these are essential goods to ship through UPS, hospital supplies, safety equipment, cleaning supplies, for critical businesses, whatever we're shipping in that regard. There's a way to triage that stuff and, make sure that gets out on time, make sure, it gets out in a safe manner and delivered. But, half of this stuff we're delivering is just bored Americans at home ordering stuff on Amazon. And it's like, at a certain point, it's not critical emergency infrastructure to be out there delivering a box of Amazon headphones. It's like, It's just not. The reason that we're doing that still is because Amazon has a buck to make, and they've laid off some of their employees. They've been forced to close some of their facilities, but they still want to keep the money coming in. I mean, they still want to make profit. That's what corporations do. UPS, they still want to make the profit, so they continue to service these deliveries that are frankly very non-essential. And as by doing that, they're putting us at risk. They're leaving us out there longer. We're making riskier deliveries than we probably should right now. All of this comes at a point where UPS Teamsters still do not have any hazard pay. If the number one demand, besides protective personal equipment, that I have heard recurringly from people is, why aren't we getting hazard pay for coming out here? We're putting ourselves at risk, our families. Why aren't we getting hazard pay? And I'll be honest with you, I never have a very good answer for them, other than the fact that the company just doesn't want to pay us because they're trying to protect shareholder profits with a possible recession looming. The truth is, we built this company. We are the only reason why there are profits to go to shareholders in the first place. And the fact that they're going to shareholders instead of us, with our labor, I mean, that's its own disgrace. But the fact then that we don't get any additional hazard pay is awful. Furthermore, though, the IBT, to my knowledge, has not done everything they can to push for hazard pay here. You have non-union employers that are offering employees hazard pay to come out and work right now because honestly, they're having a hard time getting people to work. At UPS, in our contract, it states in Article 27 that the union or the company can reopen the collective bargaining agreement to renegotiation during emergencies, acts of God, that sort of thing. And the COVID-19 pandemic certainly qualifies. Now, just to say, that means the IBT could reopen the contract and bargain over hazard pay. They could bargain over protective equipment. They could bargain over all sorts of things to make it safer for us, the 240,000 Teamsters across this country, that make all these deliveries and make this possible. They could be doing that, but they have not yet today, to my knowledge. And like I said, non-union companies are already providing hazard pay. It's a disgrace. It's an insult. We absolutely should have hazard pay at UPS. And it shouldn't be some, 70-cent raise or whatever either. I mean, the reality is, it's like with a recession looming, given the fact that UPS has already signaled that they are, probably going to do layoffs at some point during a recession. We don't know that for a fact, of course, but they've signaled it. A lot of people want that hazard pay because you don't know what work is going to look like in the foreseeable future. Furthermore, it's like, if you're out of work for a substantial amount of time, yeah, some of my package drivers, maybe you've been able to save up. But look, I was a part-timer for almost 7 years. The truth is, as a part-timer, the amount of savings you can kind of sock away for a rainy day is practically zero. I mean, you're just barely surviving in a lot of cases. And if you have part-timers facing layoffs, I mean, all the more reason we need hazard pay. If people are going to be out of work for some amount of time or see their already meager hours cut, we've got to get hazard pay for us. The truth is, too, we need, full protective equipment, hand sanitizer. I think we need free and available testing, for all UPS workers. Here's the truth. You got a lot of newer folks who are getting brought in, because UPS needs a lot more labor. They're hiring like crazy right now. You've got a lot of new employees that are still in their first 9 months working. They don't even have health insurance. Yeah, in some states, some cities, you can go and get tested for COVID-19 for free. I don't know if that's true across the board, but more importantly than it being across the board on testing, what do you do if you come back positive? And if you don't have insurance, you're still in your first 9 months, what do you do? Or better yet, what if you're in your first 9 months and you got a wife at home or, a husband at home or, a bunch of kids who are sick or come down with COVID-19? What do? UPS needs to make testing free and available, and frankly, they need to have some kind of emergency treatment, for these workers that are in that 9-month bubble from the start of their employment to, the time they get on team care like the rest of us. Reality is they need us to keep working because our labor built this company, and it's the only reason that they're able to do anything at all. We're the source of their profits, and yet oftentimes we're made to feel like we are the last concern. It goes the stockholders, the customer, and then us. I mean, a lot of times, frankly, that is how it goes. That is the way that this company works. So, don't get it twisted. We're definitely the heroes here. I mean, the working class, we're making this country continue to operate. We're making critical deliveries in the healthcare sector. That's what's keeping us alive. But the truth is, do not forget this. Your employer does not give one damn about you. And we've got to care about each other. We got to care about our families. We got to care about our coworkers. We got to take as many precautions as we can because you got one life to live. You want it to be a long one. The truth is, working people in this country, we need our union leaders to step up to the plate. Right now is the time for the Teamsters to go back to the table and play hardball with UPS. The truth is, the fact that we don't have hazard pay is a disgrace. The protective equipment, the gaps in hand sanitizer, sanitary facilities, I mean, this is a huge problem. It's putting us at risk. And the Teamsters need to go back to the table and settle that with UPS by reopening the collective bargaining agreement under Article 27. And the truth is, if the company doesn't agree to our demands, that our leadership in the union needs to think very long and hard about taking a strike authorization vote. And, that's not popular right now with some people to say, but the truth is, I think a strike authorization vote right now, I think we could win all sorts of things. And I think it would put Amazon on notice too, as some of their workers are walking out around the country because, their safety and health have been ignored just like it is over at UPS. A lot of them are talking about wanting to form a union. These people, they know labor is the source of their wealth. They know that the only reason that they have so much money, their many millions and billions and whatnot, is because we go to work every day. They want us to keep working, and they want to keep paying us as little as possible. They want to keep spending as little money as possible taking care of us. We are going to have to fight as a class, as a working class, for every penny and every day, really. Every healthy day that we have going forward. So I appreciate you all being with me through this long video here. I think this is just incredibly important that people take very seriously. And I'd like everybody to talk to their union leaders. If you are a union leader, I think, you need to get on board with this stuff if you're not already. Be very attentive to your members, communicate what's going on, give them, give them some kind of leadership right now, because I'll tell you, at the top of the chain in the IBT, I'm just not seeing it. I'm just not seeing it, and a lot of people aren't right now. And UPS certainly isn't going to provide that for us. Unions are about workers. They're collections of workers fighting for our interests, and that's what they've got to be. Now's the time to step up to the plate or to get out of line and let somebody else do it. Thanks a bunch for joining me. Hope you all be safe out there. Union power.